Welcome to page 9 of Anatomy Coloring Book. This is Dr. Stephen Harkins. The pectoral girdle and the humerus. The pectoral girdle and humerus. It's called a girdle because it is almost completely, here's the view from the top looking down. It's almost a complete circle. Of course, it attaches with the serratus anterior muscle and the rhomboid muscles here, as well as the trapezius muscle, but there is no bony connection except for one spot, which is right here. It's what's called the sternoclavicular joint. It's the joint between this clavicle bone here, in other words, the collarbone, and the, of course, sternum. So let's get down to more detail. Let's start with the sternoclavicular joint. Here is the manubrium of the sternum, as we've learned about, the top part of the sternum. And you can see how it articulates there with the clavicle. This bone is called the clavicle bone. And it's a long bone that kind of juts out laterally here, and it's covered by a ligamentous, oh, there it is right there. And it goes, anyway, there's the clavicle bone. And the sternoclavicular joint is between the sternum and the clavicle. And there's actually a disc inside there, an articular disc like you would find in the knee joint, a cartilaginous disc. And the clavicle articulates on the other end. Actually, let's continue with the clavicle from the posterior view, looking from the back now. That was the anterior view. Now this is the posterior view. Here's the sternal end of the clavicle. From the back, from the posterior, the distal end or the acromial end of the clavicle. And linking with, on the other end, with another joint, with another bone, not the sternum this time, but with the scapula. And so this joint in here is called the acromioclavicular joint, because this bone right here, this part of the scapula, is called the acromion process. The acromion process. So it's fitting that this joint would be called the acromioclavicular joint, the AC joint, the AC joint. The sternoclavicular joint you could also call the SC joint. So to reiterate, this is the only attachment that the shoulder girdle has with the body. It's the only bony attachment that it has with the body. All the other attachments are muscles. So all of your arms, the weight of your arms and shoulders, etc., attach only at one bony spot, right here at the sternoclavicular joint, the sternoclavicular joint. Now let's talk about the scapula. The scapula is this sort of wing-shaped bone, flat long and flat on your, and it lies on you and it rests on your back. And it has a few bumps that you need to be aware of. Number one, the spine of the scapula. The spine of the scapula. Let's use some colors here. The spine of the scapula is what I started to outline back here. This is the scapular spine. It forms a sort of ridge. This is looking from behind, from the posterior view. And it forms a ridge on the back that muscles attach to. And this fossa, so it forms two, the scapular spine forms two fossas, one above and one below. The infraspinous fossa, below. Infra means below. So it makes sense to call this the infraspinous fossa. And we're going to learn that there's a muscle that attaches here called the infraspinatus muscle, which makes sense as well. And then the spine, well, fossa means a hole, or a dip or a ditch. And of course, above, what do you think that's called? Above the spine of the scapula is the supraspinous fossa. And we're going to learn later that there's a muscle that attaches there as well called the supraspinatus muscle. So you can see this big protruding spine or bump off of the scapula and creating two fossas or fossae. Now, let's kind of start over here with the spine. The spine of the scapula is actually right here. Right here. And you can see it creates this is the side view, the lateral view. It creates the fossas up here. Here's the supraspinous fossa, which the supraspinatus muscle will lie in. And then you can see the infraspinous fossa underneath on the other side of the spine of the scapula. Now, laterally, we have the glenoid fossa, which is a little dip right here. The glenoid fossa, which is also kind of a hollowed out area. But recall that we're looking at the lateral view here. And from the side, that's what the fossa looks like. It's concave, like so, right here, to accept the convex head of the humerus. And here's the fossa right there, from the front view, from the anterior view. Now, jutting off of the spine of the scapula is this process called the acromion process. This is the lateral view. Again, the acromion process. And as you can see here, it's an extension of the spine of the scapula. The acromion process is an extension of the spine of the scapula. The acromion. And here it is right here. The acromion process of the spine of the scapula. And then, of course, the spine of the scapula will continue behind. This is the anterior view. We're looking from the front. If our entire body was taken away, we're looking from the front here. And so that's the spine of the scapula, extending out to the acromion process. The acromion process is the big bump you feel on the top of the shoulder. Actually, not the big bump. This is the big bump right here. Yeah, it's the acromioclavicular joint. You can feel on your own shoulder. the acromion, a hard bony part of your shoulder, and the clavicle as they come and meet together. Perhaps if you've separated your shoulder in the past, you might even have a bump, what's called a step deformity. You might even feel a bigger bump right here if you've had a shoulder separation, an AC joint separation. And here you can see on the anterior side of the scapula what is known as the subscapular fossa. Sub means under. So if you can look at the diagram at the bottom from the posterior view, we have these. First of all, we have the spine of the scapula with the acromion extending off. Then we have the supraspinous fossa here. Above means above. Infra means below. And the subscapular fossa means underneath. So it's underneath the scapula, pressed against your rib cage. That is the subscapular fossa. And this is the medial border, or medial margin of the scapula. The subscapular fossa. And we're going to learn later that that is the attachment, the origination point of the subscapularis muscle. And from the lateral view, the subscapular fossa. Here at the bottom of the scapula, what do we have? We have what is called the inferior angle of the scapula. The inferior angle. Top here we have the superior angle of the scapula. The superior angle of scapula. Here's another look at the subscapular fossa. Right here. This is an anterior view of the shoulder and the subscapular fossa. Remember, fossa means a dip or an impression, or a hole, so to speak. Another process to be aware of on the scapula, we've talked about the acromion process. Now let's talk about the coracoid process. A process just means something that's protruding from or jutting out from. So the process, or proceeding out from. The coracoid process, and this is the lateral view, so this would be the posterior, and this is the anterior. And this would be the right. This would be the right scapula. So here's the back, here's the bump, here's the ridge of the scapula that you can feel on the back, the spine of the scapula right here. This is deep, deep, deep inside on the front. You can't feel or palpate the coracoid process. And here it is in the anterior view, the coracoid process. And proceeding out from the anterior portion of the scapula, the coracoid process. It's an attachment point for for muscles and ligaments. And here it is from behind. If all the muscles were stripped away, you could see it sneaking just partially from the front. Here's the coracoid process here. Remember, this is the anterior, this is the front. The view from above. The anterior view, and this is the posterior view. And here's the coracoid process sneaking out right there. And again, right here, the coracoid process around and through, so it would be something like this. Okay. We discussed the medial margin, or medial border of the scapula. Of course, this is the lateral border of the scapula here. Lateral border. There is a notch called the superior notch. Let me erase a little bit here. Right here. This is the superior notch of the scapula. Now, moving on to the humerus. The moment we've all been waiting for. The granddaddy of them all. The arm bone is called the humerus. This bone right here. Oops, horrible. Horrible drawing. The humerus has a couple places of note, bumps of note on it. The greater tubercle is this portion of the humerus right here. Tubercle is a bump. It's got one big bump on it and one small bump on it. Here's the other bump called the lesser tubercle. This here, and then in between the two is what's called the intertubercular groove. And the biceps tendon, the long head of the biceps tendon slides right through that intertubercular groove. Of course, the head of the femur, excuse me, the humerus, the humeral head. Hopefully I've been saying humerus the whole time and not femur. This is the humeral head here. You can see it from this place as well. Now, knowing that and this is all one bone, of course, just outlining the parts of the bone. Knowing that this over here, this is the glenoid fossa here of the scapula. Knowing that that is the head of the humerus, what do you think that joint in between the two of them is called? It is called the glenohumeral joint. The GH joint. The glenohumeral joint. Of course, named because the glenoid fossa of the scapula meets with the head of the humerus. The glenohumeral joint. And as we travel down the humerus, you see a little bump right here, a raised area called the deltoid tuberosity. This as we travel down the humerus. Bump, deltoid tuberosity. And what do you think that's from? Well, that's a little bump where the deltoid muscle of your shoulder attaches, which we will learn about later. And downward at the bottom, of course, this is the shaft of the humerus. If I say femur, ignore me, it's humerus. And the medial epicondyle of the elbow. The medial epicondyle. And condyle is a bump. And above the bump, epi means above, so above the condyle, you have the epicondyle. Above this sort of bumped, above this area here is the epicondyle. It's sort of the sharp part of the inside of your elbow. The medial epicondyle right here. The lateral epicondyle. Now, there are a couple of parts of the humerus that articulate with the ulna to form the elbow joint. First, the capitulum, which actually articulates with the radius part of your arm, part of your elbow joint, and the capitulum. And now the trochlea, the other part. This part articulates with your elbow. Right there. The capitulum and the trochlea. And here's what the other side of the trochlea looks like, the back side of the trochlea. And your ulna fits right, or the back of your ulna, your elbow, the hard part of the back of your elbow, you know, the bony part, hinges and fits right into this little fossa called the olecranon fossa. This hole called the olecranon fossa. And here we see from behind, we see the lateral epicondyle, pointy spot, and the medial epicondyle. There's another little spot here called the cubital tunnel. Cubital tunnel. And the ulnar nerve passes right through this cubital tunnel right there. That's a funny bone area where your nerve can get hit and send some pain down your arm and some numbness. Let's see the other part of the humerus here, the greater tubercle from the behind. The lesser tubercle is in the front, not the back. The neck of the humerus. Here's a good look at the greater tubercle of the down here at the bottom, and the lesser tubercle and the intertubercular groove. From the front view, or from the top. Now let's look at some of the ligaments of the shoulder joint. Starting with the articular capsule of the glenohumeral joint. Here it is shown nice and slack here. The articular capsule of the GH joint, the glenohumeral joint. And all these ligaments are named appropriately. For example, the coracohumeral ligament from the coracoid process to the humerus. How about the coracoacromial ligament? Of course, where do you think that's going from? From the coracoid process to the acromion process. The acromioclavicular ligament. The acromioclavicular, going from the acromion process to the clavicle. And then a couple of coracoclavicular ligaments from the coracoid process to the clavicle. One called the trapezoid ligament, and another called the conoid ligament. See, that's not so hard. Everything's named as it should be. So if you listen a lot in anatomy and in physiology, sometimes the name will tell you where it is and where it goes and what it does. So that represents the end of page 29 and pectoral girdle and humerus. This is Dr. Stephen Harkins.